Good afternoon and welcome to the Survive and Thrive webinar series. My name is Kelly Condon. I'm the program coordinator for the Texas Oncology Foundation. And I just want to tell you a little bit about our foundation first. We are dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. Survive and Thrive programmings like this is just one of the ways that we are active in communities, both providing resources and support to all involved in the cancer journey. We also want to give a thank you to Texas Oncology for their continuous support and partnership with programs like this. And we are so thrilled to have Justin and Katie Ozuna here with us today, leading our discussion on couples walking through cancer together. Before I hand it over to them, I am going to just go through a few housekeeping announcements with you. Hopefully this will help if you have any technical issues throughout the presentation. So first of all, technical issues. If you are experiencing trouble, like your windows are disappearing or the slide doesn't seem to be advancing, I have found that normally just closing and reopening the webinar window will usually fix this. For audio issues, the best solution if you are having difficulties on your computer is to call in and listen from your phone. On your computer, you can see on the control panel, there's an audio portion on your control panel. And if you select phone call, there is a number that will populate that you can call and access the webinar from there. If you have questions for our speakers throughout their presentation, please utilize the questions tab on your control panel. You can type in comments, questions, whatever you have for Justin and Katie throughout their entire presentation, and we are going to respond to those after. And lastly, this webinar is being recorded, so the archive will be available online after this presentation. You will receive it as attendees in a follow-up email, and then we will also make it available on our Texas Oncology Foundation website. This can be found at texasoncologyfoundation.org under our programs tab, and then you'll see on the left side there is a Survive and Thrive webinar archive section. One more question before we get started. We just want to know who is on this call with us today. So you're going to see a poll pop up on your screen. Please just click. We want to know, do we have survivors on this call, caregivers, healthcare providers, or maybe we got a mixture, which is great. Fantastic. Thank you so much. Yeah, so it looks like we kind of have a nice mixture. We have a few survivors and healthcare providers with us today, so that is exciting. Thank you all for joining us. Like I said earlier, we are so excited to have Justin and Katie Ozuna with us today. This is such a sweet couple that I have had the opportunity to know. Our foundation was first introduced to them this past year at our Survive and Thrive Symposium in Arlington. And Katie actually joined us as one of our session speakers, sharing her insight with caregivers. They are truly such a remarkable couple just to get to interact with. They are so genuine and authentic, which I think will easily come across as they present today. Their story is just impactful and encouraging. And I think they'll have allowed their experience to influence their perspective and the way that they have lived since, which is just incredible. So thank you both for continuing to participate with our foundation. We appreciate that you allow us to keep engaging with you. So anyways, I'm going to hand it over to you guys.
Thank you so much, Kelly. That was such a gracious introduction for sure. So we are Justin and Katie Ozuna. Justin is my husband, a cancer survivor. I am Katie Ozuna. I am his caregiver. And I'm sure I've met some of you at those Survive and Thrive symposiums. I love them. I am so thankful to Texas Oncology for letting me come back each time. So before we begin, we wanted to just let y'all know, let you in on Justin's pharmaceutical company is here filming us. So do you want to
Yeah, so if you see anybody in the background, that's who it is, and we apologize in advance. But we're doing this Real Housewives of Cancer. I'm just kidding. We're not. It's just for internal video, but yeah. So that's what's happening. And thank you again, Kelly. Thank you for everybody for joining us. We're so excited to be here. I think to give you kind of a little context of what we've gone through as a couple and me individually, and her as an individual caregiver. I kind of give you a little context. So I was diagnosed with chronic myeloid leukemia in 2006. I was 24 years old. I was living in Wichita Falls, which is this small town of 100,000 people. And I didn't know anybody else my age with cancer. I didn't know, I didn't have any really experience with cancer, the emotional, the physical, any part of that. And so to be diagnosed with this chronic form of leukemia, which is essentially in my DNA, there is a Philadelphia chromosome, and the chromosome translocates DNA strand 9 and 22 so that it forms immature white blood cells. The blood cells enter the bloodstream without maturing, and they're unable to fight disease. And so in 2006, January 2006, I started on oral chemotherapy, 1 pill a day, to prevent that translocation and essentially kind of give me a relatively normal life. But here we are 13 years later, and I'm still living with cancer. I'll probably live with cancer into the foreseeable future. And we've kind of built our life around that. And so as a part of that, we love speaking to other cancer survivors, other caregivers, to share our perspectives and the things that we've learned, because it definitely hasn't been easy. In fact, 1 year after, it was about a year and a half after I was diagnosed with CML, I met Katie, and in that period of time, I really struggled. I struggled a lot because while my family was there when I was initially diagnosed in the first couple of appointments, I took on this kind of I was in this protector mode, right? Like I wanted to manage their emotions for them. I didn't want cancer to infect my family, infect my friends. And so I kept a lot of those communications to myself. I didn't let people know that, hey, look, paying for oral chemo every month is a challenge. $150, $125 doesn't seem like a whole lot now, although it still is. But back then, when I was 24 years old, I was still in college. I was trying to figure out my way in life. I had no idea, like what barriers, what challenges, what resources to use when I ran into those challenges. And so I struggled with a lot of non-adherence those first few years, not because, I didn't want to take my medication, but it was simply because I couldn't afford the medication. I couldn't afford, the doctor's visits and the bills and the blood tests and the bone marrow tests and everything that comes with a cancer diagnosis was very, very challenging for me. And so having said that, I kind of brought Katie into this cancer world. She had no idea what cancer was like, and quite honestly, I had no idea how to communicate that. And so I met her a year and a half later. So in 2007, we kind of met on Match.com and formed this relationship. And that's kind of where I said, hey, I have something to tell you. And
sure. So also, just a side note, we have made a PowerPoint presentation, but we just filled it with pictures of ourselves because we wanted this to be more of a conversation. So I hope as we go along, you're asking questions that we can answer, because we really wanted it to be a conversation between us and with you guys versus just running through slides for an hour. So these pictures are right before. Justin, you can see, is looking at those hot dogs.
Yeah, and so your first question might be, why am I using my fingers to turn the bratwurst? And that's because I forgot my tongues. We were at a baseball game, and so
That was the only picture I could find of him pre-cancer or pre-meeting me, pre-diagnosis. We don't talk about the life before I came along. And then these other pictures are just right after. The bottom right is when we first met. The bottom left a week later, and then I don't know when the top left was taken, but it was before we went to MD Anderson. So back to the story. When Justin and I met on Match.com, it was such an exciting time. And we actually talked for 2 years before we met in person, and we were just kind of friends during that time. But when he told me he had cancer, I really, as a 23-year-old, I didn't know what cancer meant. I knew it was supposed to be scary. But gosh, I was just so thankful he didn't have a wife and 3 kids. Like, oh, you don't have that? Okay, we are good to go, friend. And he also said, oh, I'm in remission. And I was like, okay, I don't know what that word means either, but great. And I don't think Justin really knew what that word meant either. As we started dating, and we were dating long distance, I noticed, Justin wasn't really, like he said, he couldn't afford his medication, so he was trying to just use it as he could. And so he also was having some fatigue and issues with chemo. And so when we met as a caregiver, I really didn't know what my role was. He wasn't super sick. We weren't in the hospital at all times. And he really didn't let me into kind of that emotional struggle and that emotional journey that he was on.
Mm-hmm. Yeah, until 2009, 2010 was really kind of when, a lot of the challenges that we faced. And when you typically think of like a cancer experience, that's kind of when a turning point was for us, because I think kind of that history of non-adherence and really struggling with a lot of cancer early on kind of left me feeling isolated. And as a direct result, I wasn't able to pursue the help and the resources that I need, and my medication eventually just stopped working. Our doctors, not only did so I moved to Dallas from Wichita Falls in 2009, had a very hard time finding an oncologist that would accept me as a patient because of not showing up for appointments, or maybe not taking my medication as I should have. All of these different things that kind of made me a liability as a patient. And it was the first time it really opened my eyes to the fact that, I wasn't doing things the right way. And so we eventually got into a new doctor. I was so gracious. Katie, I was like, hey, you have to go to this appointment with me. And we're just telling our story. And I was like, please just give me an opportunity, give me a second chance to be the best patient that I can possibly be. I started eating right, getting into the gym, doing all of the things that I should have been doing, asking for help, meeting with social workers and applying for scholarships and all this kind of stuff just to pay for medication. And over a period of time, that wasn't enough. That medication just didn't work anymore. And so we looked at kind of what that second line medication would look like for me. And so they did a mutation test. Mutation test came back and it showed that I had what's called a T315I mutation. Mutation prevents any oral chemo on the market back then in 2010 from working. And so it's essentially, and I was sitting in my work truck and they couldn't tell me exactly what this meant, or what kind of the next steps were. They just call you with information and kind of tell you, and it's like, okay, bye. And so, unfortunately for me, that meant, Googling something, right? And we know as cancer patients and professionals, Dr. Google is not great. He's really not awesome. And so I Googled this mutation and it said there's no known treatment for this mutation. And it was devastating. And it was the first time I really had to pull Katie in and say, look, we're about to face a lot of uncertainty here. I don't really know what the next steps are, but I hope that we can do this together. And we're still we were still dating at the time. And so as we were trying to figure this out, Katie was in grad school. She was like, did this graduate internship in India. And so by the time everything finally settled out, she had gotten back from India. We had gotten engaged. It was just terrible timing. I didn't know like what our future held, but we got engaged because I wanted to show her that I was really committed to her. And like she was going to move to Dallas from San Antonio. And I wanted to be very intentional about kind of our next steps. And little did I know our next step was a clinical trial at MD Anderson. That was kind of the only opportunity that we had. So I was a part of this clinical trial, and after about 2 weeks, we were all excited, we were optimistic, we were hopeful. I started to lose function and just muscle fatigue. I couldn't walk. We would take a walk every single day. And oh, by the way, during this time, Katie graduated, so we had never lived together. We never even lived in the same city. Katie went to India for 6 months and came back, and our next step was to go to MD Anderson to be there for 3 months. Like, so we were there together in one room, 24 hours a day for 3 months, as we were trying to kind of figure out what our next steps were and all of this. And so that was kind of where we really first kind of hit the ground, and it was kind of that was where most of our experiences really started to get real. You know what I mean? Like, it was, we had talked about cancer, and I talked about remission and all what that meant, but to actually go through it and go to the doctor's appointments every day, to sit in a waiting room, and to not know what was next, not know what was coming, it became very, very real to Katie and I.
Yeah, I think that's really when my caregiving journey, as Justin keeps saying, got real. These are all of the 5 photos I took while we were at MD Anderson for those months. I know everyone is shocked I'm not a natural blonde. No, but so these are the photos I took, but it really hit me. It hit me hard that, one, okay, we're engaged, and not so much we're engaged and Justin has cancer, but we're engaged, and I don't know how much of a future that we're going to get together. He was so sick, and instead of this happy, joyous time, it was really kind of into the battlefield we went. I, as most caregivers do, had to start learning terminology. I quickly learned what remission is and that we want to get there. And I learned what a bone marrow biopsy was, what a bone marrow transplant was. I learned all the different types of chemos Justin took that weren't working. I learned what a clinical trial was. And I also learned that caregivers oftentimes feel invisible. I sat in so many doctors' offices, and this was at MD Anderson, a teaching hospital. So I would sit in an office with Justin and his oncologist and all of the students under him, and no one said one word to me. And not that I needed them to, but I learned that man, caregivers really, we have to be our own advocates. And so it really hit me then. And like Justin said, there's no roadmap for what it means to be an oncology patient, what it means to be a caregiver. And I really didn't take the time for myself. As much as Justin had started letting me in on his journey, I didn't know what to do with all that information. I didn't know that it was appropriate for me to reach out to someone to get counseling. I thought at that time, hey, I don't have cancer, so I have to do everything for this person that I love, regardless of how it affects me. And now working in oncology, I see that is still the mindset, the determination of a lot of caregivers. And since then, I've learned a lot about caregiving and what tips that we can use as caregivers to still support the person we're with, but not at the detriment of our own health. And so we'll get into those takeaways in a minute.
I just want to say, I was looking at these pictures and it makes me like so sad, and not because of kind of this period of life. It's just, look how much hair I had. That's like, I don't have that anyways. not cool. But our spoiler alert, the first trial didn't work. I couldn't walk after a period of just 2 weeks. I thought I was having a migraine. I couldn't, any light that I looked at had this glow. And eventually I kind of lost a lot of my eyesight. Well, it turned out I was just having toxic side effects that permanently damaged my eyesight in one eye. So we started the process of looking for a bone marrow donor. We started testing my family, started looking in the donor database and kind of learning what that process looked like. In the meantime, my oncologist was working hard to get me in a closed clinical trial that had been very effective for people with a T315I mutation like me. But we really didn't know if I would be able to get in. Well, fortunately enough, through the hard work of my oncologist and the wonderful people at the pharmaceutical company, they let me have access to that medication. 3 months later, I was in a cytogenic remission, and 6 months after that, it was a molecular remission, which is about as good as it gets in the leukemia world, the chronic myeloid leukemia world. So during that time, though, we really made a conscious effort to embrace cancer and to embrace the things that we were going through, because I didn't want to go through this experience not having taken something away. Not having seen opportunities, because I did that for a long time, and I try to push adversity away, and I try to pretend as though everything was okay when in fact it wasn't. So I made a commitment to myself, and I made a commitment to Katie, my new fiance at the time, that I was going to do everything that I possibly could to move forward. Through adversity, through the challenges that we faced, through the unique experiences that we had together. And it was that conscious decision that that lifted my spirits. It allowed me to kind of continue on when, things were tough and when we got bad news. And, when, you can see how tired I was in these photos. And it was just kind of a really, is a crash course in life. And so I think, we wanted to share kind of our key takeaways, the 3 things that we essentially. We're getting way. I'm getting way out.
Hold on.
I'm getting way out of ourselves.
So we first wanted to talk about what life looked like after he reached a molecular remission.
Yeah.
And so again, here are some snapshots. Justin, he graduated college after dropping out
3 times.
3 times, enrolling 4. He graduated. And I have to say, between our wedding and all of those things, this was the happiest day of my life, was seeing Justin just reach this goal, the first person in his family to graduate. And it was such a great day. And then I didn't even put a picture of our wedding in here, but we adopted 3 dogs. We got married.
Believe it or not, we got married.
We bought a house. And then we really made a promise to ourselves, to each other, that we wanted to give back. That even at MD Anderson in those dark times, we started giving back. Justin and I both started blogging for MD Anderson. I blogged once and he blogged many times. And then we started speaking. When we moved back to Dallas, we started volunteering locally with hospitals here, with nonprofits. Any chance we got, we volunteered and we gave back. And our goal really in survivorship, now we're so fortunate. But our goal in survivorship as a couple is to give back any way we can. This is now my career. Being in oncology, an oncology social worker, a navigator, I can't imagine giving my life to anything more meaningful. I tear up thinking about it because it is such a blessing. It's I don't know what I've done to deserve such favors from God, but to be able to give back to other people is truly one of the best things in my life. So now we'll move over to Justin's section.
Now for the takeaway. But we wanted to share, like, I mean, there's so many important lessons, and it's hard to cram, like, you know, that's 5-year period of time, that 6-year period of time, into kind of 3 points. But we didn't really, it's not about us, because when we speak, it's about everybody else who's experiencing the same things. A lot of young adults, you know, ages 18 to 39, that is a pivotal point in their life. You know, they're graduating college, starting their careers, you know, they're having children, they're getting married, all these different things that are happening that are key monumental points. And, you know, on paper, it just looks as if, oh, this patient is just non-adherent, or this patient is, you know, it just doesn't want to get with the program, or whatever like that. And so it's really important for us, and to use our experiences, in particular me, to put color behind the cancer diagnosis, to show the reality and authenticity behind that, because I think that's very, very powerful, and that speaks more than, you know, any kind of clinical research, or you know, any kind of publication that you might read. And so that was very, very important for us. But from my experience, I really, really challenge you to embrace adversity, because when you push it away, when you run from it, when you pretend it doesn't exist, there are lessons that you're missing out on in life. And I hate to say lessons, because it's like, you know, like you're sitting in a classroom and it's like you're being forced to learn. What I mean by that is that there's an opportunity in every conversation, every interaction, every communication that you have, to not only share your challenges, but to talk about your victories, and to talk about, you know, the things that you can improve. That was one of the important things that, you know, we made a conscious decision about when we were sitting in the waiting room. You know, it was like, well, what can we do better? Like, how can we, you know, how could they improve this process? And you know, in terms of just, hey, how can we meet, you know, people who are gonna, you know, kind of walk with us, or at least provide some type of game plan, right? Like, at every appointment, they talk about, okay, here's what you need to do today, but they don't talk to you about tomorrow, and they don't talk to you about, like, what happens after you leave. They don't give you kind of this long-term vision, the barriers that you might experience, and the resources if you do experience those barriers. And so there's so much opportunity there to you know, to enrich your lives, enrich the relationships with the people that you love, to have better conversations, more meaningful conversations, and to be a lot more intent based. That was a huge learning lesson for me, and it's something that I continue to apply today, in every, you know, opportunity that I have. When adversity happens, I no longer think of it as failure. I think of it as an opportunity, to do something, to share my experience, to just gain a different perspective on life. Because here's the reality: like, I'm going to face adversity for the rest of my life, whether it's cancer or not. And so I have to, I really have to, look at adversity differently. If I don't, then, you know, we're gonna waste it. We're gonna, you know, what if I had never learned anything through that period of time? I just went, got my treatment, went home, told Katie, hey, don't worry about me. I'll just be at the, you know, I'll be at the hospital. Don't worry about me. And then I came home, didn't talk about it, you know, didn't really express, like, we wouldn't have the chance to encourage and inspire and to tell our story, and to say, like, look, this is okay. You know, I'm still receiving messages from MD Anderson blogs that I wrote, you know, 7 years ago, messages from around the world, people saying that, hey, look, you know, I met this guy, he has CML, my parents don't know about it, you know, like, what's your advice to me? So, you know, little things like that, the things that you don't really think about, are come packaged in adversity. You just kind of have to embrace it, and really not try to run from that.
Yeah, and so from a caregiver perspective, we wanted to give 3 takeaways from a caregiver, from a patient, and then as a couple. And for me, when I speak to caregivers, it's really important for me to emphasize that you have to be intentional about caring for yourself. You have to work it into your everyday life. It's not, okay, you went to a movie last year, so you should be even keel, no stress. That movie really did it for you that year. It's something you have to do daily. And I know it as a caregiver, every time I go to a conference, I hear that, okay, it's important, practice self-care, practice self-care, practice self-care. But looking back when I was with Justin and we were at MD Anderson and I was so bogged down and overwhelmed, I felt like I couldn't practice self-care. I felt guilty thinking about myself. I constantly went back to, well, I don't have cancer, so I don't need, an hour break. I need to do laundry. I need to do the dishes. I need to help Justin. But I wish I could go back to that brunette Katie and tell her, girl, you need to take a break. And really find out and be intentional. Again, intention is my emphasis. Be intentional about what works for you. For me, I know now that when I incorporate exercise into my life, I am a better wife, I'm a better employee, I'm a better friend. But man, I don't wake up, I never wake up in the morning like, oh, I can't wait to run today. Like, how many miles will I run? That hurts my knees even talking about it. But what works for me is that Justin every morning drags me out of bed and
really drags.
And I'm grumpy about working out, but then I do it, and then afterwards I feel better. I'm a better wife to him, more patient, better employee, better dog mom, and so I found that's what works for me. So really taking the time, if it's mindfulness, if it's meditation, if it's yoga, if it's being with your friends, I really challenge you and encourage you to find what works for you and implement it more than once a year, more than once a month, more than just once a week, daily if you can, but gosh, at least 5 days a week. Do that. Make yourself the best version of yourself so you can be there for your partner.
Yeah, and I think as a patient, I have been in the oncology world for a number of years since then. And I always say, caregivers have a special place in my heart. So as a patient, it's just as they would encourage you to rest up or, take your medication or whatever. I really try to be very, very intentional about saying it, you need this time for yourself, doing things outside of kind of my responsibilities, to really give Katie the luxury to not feel guilty about, not taking out the trash and not doing the dishes, the things that we have to do as adults, right? And that's one way that I could help, is just by saying, really take some time for yourself, go do this, go, take a bath. I think that's one of the things that she's really gotten into, just because it's so relaxing and she has time away just to kind of do her own thing, and it's so important. And lastly, I think from a couple perspective, one of the things, there's so many different takeaways from living with a chronic cancer, but one of the important things is really, really focusing on communication. And when I'm talking about communication, I'm not talking about the dry, the boring, just listen to me, kind of stuff. It's really communication is a synonym for relationship. Really focusing on not only communicating your needs, but really receiving. More importantly than communicating is receiving information from the person that you're with, the person that you're going through this trial with.
And really, that communication starts with us. It starts with you. And for me, it's really identifying what are you really feeling, right? A lot of times we go to these broader umbrellas. Oh, I'm angry, I'm mad, I'm upset. But before you're communicating to someone else, you really need to explore what that feeling is. Are you angry or are you disappointed? Are you fearful? Are you feeling isolated? And then also, what do you need to get out of that space? And I think a lot of times, and we learn this, we have a story that we always tell. We learn this together. The story that we always share, and the
hard way, by the way.
Yeah, we learned it the hard way many times. And so the story we always tell is we were in Houston. Well, you tell it.
Yeah, so it was during the first clinical trial. We really didn't know what to expect, but as the days went on, we would go to MD Anderson for the day and be there most of the day. I'd come home, just kind of relax or try to. But eventually it got to the point where it was very, very hard for me to get out of bed. Like I just couldn't really walk that effectively. It was hard for me to see things. So I started listening more to things. And it was very, very difficult, emotional and physical period. And so there was this one day I was just like, it'd been a long day, and it'd been a long couple of days, as a matter of fact. And Katie and I, again, we had never lived in the same city. And here we were kind of living together on top of each other in the spare bedroom of her best friend's house, and together all day, every day. And so, over a period of time, it was just kind of like, look, I just want to write. I don't want to have to answer questions. I don't want to do any I don't want to engage really with anybody but my mind right now. And I didn't obviously know how to say that. So I was like,
he said none of those things he just said. So pretend that he didn't say those things.
So I did say though, hey, listen, I just kind of need some time. It came out in a frustrated way. Typically communication comes across,
So he said in actuality, he was like, I need a break. I need an hour break from you every day. And so me, clearly I am a joy to be around at all times, first of all. Second, I took that as an overwhelmed, overworked caregiver, as, man, you need a break from me. I heard it as, you don't appreciate me. Mm-hmm. You don't want to be around me. And I got, as you can imagine, very angry. And I told him, well, I need a break. You need a break from me. I need a break from you. Mm-hmm. And then surprisingly, Justin came back and said, yeah, I think you need a break also. But he got several hours of break that day from me. Many hours. But that conversation, right? So that conversation obviously was a fight. We were he was trying to express something, didn't know really what he was trying to express. I received it with my own filter. And then we didn't talk for a while. And
part of that was because I led with emotion, right? I was frustrated. I was frustrated with the day. I was frustrated with my experience. I was frustrated with everything. And I kind of led with that frustration. The frustration was a vehicle that said, I need time to myself. And of course, that vehicle of frustration is going to come to her as a lack of gratitude after all the things that she had done, after, kind of putting her life upside down and being there for me. And so I think the lesson for me was to not lead with emotion when you're communicating, lead with kind of the self-awareness and the need to say, hey, listen, I to be a better husband, to be a better boyfriend, to be a better fiance, I need this time so that I can just reset my mind and reset my focus and perspective. And I wish I would have put it that eloquently back then, but that's what I meant. It just didn't come across that way.
But that speaks to kind of our third point, is we were able to revisit that conversation a couple hours later. And Justin said all of those things. I need to reset. I'm around people all the time. We're around each other all the time. Yeah. And when he put it that different way, obviously that's easier to take. Obviously, I know where his heart is and where he's coming from. And it was great to take that break. And really, he gave me that permission to take a break too. And And so our last point with communication is really always reevaluating your communication techniques as a couple. You know, now 7 years out from MD Anderson, we still reevaluate how we're communicating. If we have an argument, we take time to really reflect, both of us. I reflect as an individual what I'm trying to say, but we look at that argument as outside of our relationship. You know, when I met Justin, I never thought of cancer as a deficit of his. I always saw Justin as this beautiful light in the world, very funny and less funnier than me. But then, and I saw cancer as something separate from him, something that he is battling, and then together we're battling. And now in our relationship, years later, it's the same. We are able to take those arguments, those miscommunications, and look at them as something we are working through together versus, you know, it's me and how I feel against him and how he feels. And gosh, I'm so thankful for that.
Yeah, of course. And yeah, I mean, it's just a lesson learned. And had we not kind of embraced that adversity, had I not kind of thought about what I said and how could that have been misinterpreted, right? Like, that's a common thing. A common theme in relationships is like, how was my message misinterpreted? Because I knew what I felt. And you should have understood that, right? But that's just not the case. And going back to kind of receiving information, just because I'm going through the cancer experience doesn't mean I know what she feels like. I feel as if though I'm in control of my treatment. Like, I still to this day have to take medication. And so I never considered the fact that for Katie, she's never been in control. She's never been in control of anything. And as somebody who is looking at somebody else that they love, that has to be very, very difficult and an experience hopefully I never have. But, you know, had I not had that level of empathy or understanding of this whole process, had I not been self-reflective, had I not really said, okay, like, we're a team here. Let's figure out what's going on as a team, so that, you know, I'm not trying to get the upper hand. I'm not trying to say like anything's more complicated or more difficult. This is not a competition. This is really this is an experience and a life lesson for the both of us. And that's really how kind of we have, you know, packaged this, you know, this cancer experience, and it's how we kind of continue to move forward. So I don't know, that's just kind of a couple of things that I think, you know, we've taken away, and it's not to say that everybody will experience the same things. I think cancer is very, very individual, and, you know, it's you know, I think the best thing that you can do is really kind of, again, just have your own takeaways from it, but really use that, kind of flip it inside out, and encourage other people and inspire other people with the messages and the lessons that you learn. And that way, you know, it's like you can stick it to cancer somehow, you know, and just say like, look, it didn't take anything away from us.
Yeah, that's for sure.
And it might, right? Like, that's not to say that it won't at some point, but as of right now, like, it's added to our life because we've been able to embrace it, and it's enriched our lives as a result.
It's true. And I think those really hard times, as Justin said, being able to reflect on them, taking that time to really look at an experience in a really objective way. And, you know, when you're in it, it's emotional, you're trying to just get through, but taking that time to really view those experiences in an objective way have given us lessons that we carry with us now, that hopefully we will always carry with us. You know, but we both, just, if we could say anything, are just so thankful that we can give back
Yeah.
I wake up with a grateful heart every day that I get to be with Justin. We have our 3 dogs. We get great experiences to volunteer and impact other people. And so, I encourage you to just look at your cancer experience in that way together. How can we impact other people? What can we take away with this? How can we grow from this? And I'm confident that will just give you happiness. Well, I'm confident and I hope that it will give you happiness and purpose, and it will take some of that power away from the cancer itself.
Yeah, of course. And no matter what, I think just like keep moving forward, right? Like just keep moving forward regardless of your circumstances, regardless of the things that happen to you. Always say that life is not about what happens to you. It's about how you respond to what happens to you. And so yeah, I think that's something that we have to continue to work on. It's like, oh, we have this in the bag. There's so much that I have to learn. There's so much that she has to learn. There's so much we have to learn together that we will eventually get there. But, I think kind of we're taking it one day at a time. And with kind of a foundation of gratitude, we're able to accept that. We're able to kind of to move forward. So thank you so much. I think that is kind of our experience, our story in a nutshell.
Yeah, as Justin said, it's tough to put all of those years and all of those experiences into, a 45-minute presentation, but we really wanted to be, again, intentional about allowing time for questions. So I hope that you've been asking questions. If not, it might get a little awkward.
If not, we'll do a Q&A.
Guys, thank you so much for sharing your story and your experience. One thing I just really appreciate about the two of you, and you pointed it out at the end, is this is a process to change your perspective and to change the way that the experience impacts and influences your life. And so thank you for just pointing that out, for making that known, and just for letting your story show that. That is super encouraging.
Well, thank you, Kelly.
Yeah. And just I really love this comment. One of our attendees, Julia, said, "You guys are amazing. Really want this message to get out to bigger audiences." And she said, #Real Housewives of Cancer. I loved that. Y'all are going to go viral.
Thank you. That is my ride or die sister right there. Thank you, sis.
That's awesome. So one question that I had kind of had early on, Justin, when you were talking is, you said when you were first diagnosed and you were kind of walking through it a little bit on your own, and you mentioned that you felt isolated and that you just didn't really know where to get support or how to find that support. Has there been anywhere that you have found were good resources for support, or people who are feeling isolated, who can they reach out to? Any advice or learned from that?
Yeah, I think the important thing is like just reaching out, right? It's just like being passive versus being active. I think initially those first few years I was very, very passive, and in treatment and finding resources and doing a lot of different things. I just wanted to be 20-something. I wanted to be, like hang out with my friends on the weekends. I didn't want to have to, like take time out to go to the doctor, or to fill out an application, or to do things on my own. And had I been more active and actually just reached out to anybody, I mean, the nurse, the social worker, anybody that might have been more available to provide me, or at least point me in the right direction, that would have been like an awesome first start, But when you don't embrace something, when you don't acknowledge something, it's very, very difficult to get that first start, right? And so.
And I think also, you can, like Justin said, ask a social worker, ask your nurse, ask your physician, say, hey, this is a barrier for me. Where can I get support for that? You can definitely, if you're at the hospital, ask where their cancer resource center is. You can go online and search support groups for this cancer, support groups for caregivers. But like Justin said, I think it's so important to reach out. We never reached out, and gosh, I wish we had. I really wish we had. There's so many awesome, like these Survive and Thrive symposiums where you get to go and meet other people, and just be in a space where everyone gets it. We all get it. And that's so important to find those people.
Yeah, and that's a game changer really for me, was meeting other people with cancer, because then it became, okay, like I don't have to take this on myself. Somebody has had different experiences. And so Katie makes a really good point about, reaching out to, medical team and trying to find the resources available at your place. But then more importantly, I mean, there are so many resources online. Texas Oncology Foundation has done a really good job of bringing those resources to life and bringing them to patients. And so if you have an opportunity to go to one of these events, I really highly encourage that. But yeah, I think really kind of any step in the right direction is kind of being active in your treatment. And that's always better than passive. One other thing I wanted to say about that is, one of the challenges in finding resources is, number one, not identifying what those barriers are ahead of time. So it's like waiting to ask or reach out to resources until you're in crisis mode, right? Until somebody like has to do something like right now, today or tomorrow, or like my lights are gonna get cut off, or like I can't pay my mortgage or something like that. So being very proactive with your medical team about, okay, what types of barriers might I run into? Or maybe it's a social worker or somebody in the community that you reach out to. It's saying, hey, what types of barriers might I run into? And once I do run into those barriers, where can I, turn for resources? So having some type of resource list ahead of time is going to save you a lot of heartache, and it's going to allow kind of open more doors for you to have more opportunities to benefit from resources. And so I think that's very, very important, because we a lot of the times don't think about the timeline of resources. We simply think, hey, they're out there, right? And why aren't people taking advantage of them? Well, they're not, because they're not preparing for it. They're just kind of experiencing barriers and then responding to it. And so that's a very, very important thing, a tip, a life pro tip I would give to survivors and caregivers as well.
Awesome. Yeah, I agree. And then Katie, kind of on the flip side of that, what are key indicators for caregivers that it is time to reach out for help for themselves?
Man, so just jumping off what Justin said, every time is the best time to reach out for yourselves. I would start literally after you find out that after the cancer diagnosis, reach out and take time for yourself. And again, as Justin said, be really proactive. You have to be your own advocate. And reach out. I would ask your medical team, hey, where can I go for support? I need individual counseling. I'd love to join a support group. You can even, if those are a little intimidating, you can even reach out online. There are a lot of private caregiver groups on Facebook. There's a lot of forums for caregivers. There's also a lot of information. American Cancer Society has this great caregiver burnout checklist. So you can really see, okay, where am I? But if I'm giving my friend advice, I'm saying just start right away.
Yeah, that's awesome. We got a comment from another attendee. It says, as friends and family announce the unfortunate news that a loved one has cancer, I always want to do something, anything to help. Because of your experience and takeaways, I am encouraged to lift up the caregiver and let them know they need care as well. And they just want to know, how can I best connect them with ways to read your blogs and other resources? They're all over the country, and they just want to share your information.
Man, that is so sweet. That's such a compliment. Thank you so much for saying that. Man, and I will say before we answer that I get this question a lot. I want to help. And the survivor or the caregiver will say, no, I don't need any help. Like, again, trying to take on everything. themselves. And a good way that I put that when I want to help someone, I know they need help and they won't allow me to help them, is I say, please give me the gift of letting me help you. Give me that gift. Give me that joy of being able to help someone that I love. And usually who can say no to that?
Yeah.
I am very persuasive.
Yeah.
Give me the gift of buffalo wings.
Yeah,
please,
and that
Justin.
comes from the perspective as a cancer survivor of not wanting to put out anybody else, not wanting to like allow my diagnosis to impact or impact, you know, anybody else. And so when you come across this situation, I think that's a perfect way of saying it. It's just, look, this is a gift to me to be able to give to you, to provide you a level of support that I know that you might not think you need, but like you're going to enjoy, and this is going to be a you know, pressure off your shoulders. And so that's an awesome way to say it. But I think going back to kind of my blogs, I have a blog, a personal blog, at theozunaverse.com, OZUNAVRSE.com. And that was a place where I, you know, shared my stories and shared my experiences. Of course, I lost a lot of that blog, unfortunately, and I have a backup on a computer that the screen doesn't work, and so I'm hopefully going to restore that soon. And and I'm going to link to a lot of my other posts, you know, kind of the things that I've written and I've shared, and I think that would be kind of a place. But you know, like that's if you want my personal side of it and Katie's personal side and kind of our experience. Texas Oncology website would be, of course. We can also link to it there too.
You know, and then Kelly, feel free to give our email addresses out. We're both on Facebook, but I'm not on Facebook very much, to be honest. But you can connect with me through email, through Facebook, through LinkedIn, through his blog. If you find his blog, definitely you can find us through the Texas Oncology Foundation as well. We have a sheet up there about communicating cancer that Justin wrote that is really, it starts off with a checklist of where you are, what you want to communicate, and then has tips for communication in there. And gosh, I love that checklist. So if you want to learn more about communicating, that's definitely the place to go.
And here's the thing about communication. I was not very good at it. And so like, I don't want you to feel as if they keep talking about communication, like they must be really good at it. Like, no, I wasn't. I came from a family that like really didn't talk about things. Like we didn't talk about, you know, like emotions and kind of what we were going through. We just kind of loved each other in the way that we knew how, and that didn't involve communication. And so really the fundamental turning point for me was when I met Katie. We were kind of going through this experience together, and I started seeing that like I could help her by having these conversations, by being very authentic and being very genuine and empathetic with her. Like that was a way that I could kind of control our experiences, if you want to say it like that. But was just to reassure her, to constantly listen, and to kind of and
also for you to like also learn to listen.
Also, to learn to listen. So,
I wasn't the only one learning to listen.
We'll put in our PowerPoint slide. but yeah, that would, yeah. So I don't know. I hope that helps. I really do, because I think anybody has the ability, and anybody can develop the skill to live the life that they want. It just takes being very, very intentional, like Katie said. And being very strategic about how you want to kind of approach it.
And we also obviously love communication, love talking. We love to connect with other people too. So please find us and connect with us.
Yes, I love that. Perfect. Well, thank you guys so much. I just want to thank all of our audience members for spending this time with us. A reminder, this was being recorded and will be live on our website. And I love that y'all were plugging all the resources on our website. I'm going to shamelessly plug it as well. I was actually thinking when y'all were talking about the communication handout that you shared at our symposium, and that is on our website. So again, it's texasoncologyfoundation.org, and all of our resources are available under our communications tab. And so there's a resource section under there that you can find these great tips, and there are things for caregivers, there are things for patients, there's things for the family. So go check it out. And if you are looking for an event just to meet others that are also going through the cancer journey, just like Katie and Justin already mentioned, the Survive and Thrive Symposiums, we are actually having one in Waco on April 27th. Registration is still open. So again, go to our website and under our programs tab, you will find all of our symposium information. Thank you guys so much. This was wonderful.
Thank you so much, Kelly. Oh my gosh, this was such a pleasure. It was really awesome. Thank you.
Yes, thank you guys. Lastly, as we bring this webinar to a close, there will be a survey that's going to open up on your screen. Please just take a moment to provide us with feedback on today's presentation, as well as other topics that you'd be interested to see covered in future webinars. Thank you guys again. This was so fantastic.
All right. Thank you guys. Thank you so much for joining us.
Thank you.
Have a good one.
All right. Bye.